Welcome back. Patients recovering from strokes or debilitating diseases like cancer often face a long and frustrating road to recovery. But a promising rehabilitation therapy is helping to make those recoveries less traumatic. Pearl Magazine's Tina Jiang recently met a therapist who uses music to help patients find their new normal.
The Bund, a Canton pop hit from the late 1970s. This choir is just getting warmed up on a Thursday morning at this rehabilitation center in Quarry Bay. They have an upcoming public performance in a few weeks, so everyone needs to stay focused. Among the 30 choir members, most have recovered from strokes. Some have physical disabilities. Some have aphasia, a neurological disorder that deprives patients of the ability to read and write. Experts say aphasia can be caused by a brain injury to the language area in the left hemisphere. One such injury is a stroke.
Even though they can't sing it very fast, they can sing more words than they speak. And we can see the result immediately. So we use music to help them to regain their speech.
Kingman, a music therapist, formed this choir 4 years ago, hoping to give stroke patients some motivation in their rehab. The aim is to improve their speech abilities with the therapeutic power of song. Patient Leung Mei Yung is a member of the choir.
我今年65歲，唱咗歌有4年。
In 2014, Leung had a stroke. Immediately after that, she lost her speech. The former accountant had no choice but to retire early. It's been almost 5 years now, and Leung still bears some emotional scars when talking about the experience.
曾經覺得自己好似對住4邊牆，感覺疲困，心情好灰。但係我決定要積極面對治療，要一點一點向前望。過程中遇到一班同路人。一齊學習與進步，彼此關懷與愛心，一定能超越障礙。
Her sister has been taking care of her in recent years. Now they know how to use melody to communicate with each other.
When she wants to express herself but fails, I start humming. Then she would sing the words out naturally. And then I know what she's trying to say.
Leung's sister says she didn't know much about aphasia at the beginning, but gradually accepted the fact that it's going to be a long journey for her sister to recover. When there's a will, there's a way. Music seems to be the panacea. Leung can now express herself confidently and more fluently with music. Like Leung, many stroke survivors with aphasia struggle to communicate, but they feel they found a way out through melodies. One music therapist says that's because singing involves more areas of the brain, and that they might still be accessible despite injury to other parts.
The speech pathways might be damaged, but we can use music to access the speech area with another alternative route. So that means you can still get to your speech part, but you've got to go through a newer, maybe a less practice route. So when we do music therapy, we add music onto everyday sentences, so they are essentially singing out what they want to say.
Chung and Ho both returned from studies overseas. They became registered music therapists in Australia in 2012 and 2013 because music therapy-related courses were not available at any institute in Hong Kong at the time. Helping stroke survivors regain their speech through music therapy has become increasingly popular around the world. But in Hong Kong, the practice remains in its infancy despite its numerous benefits. There are also many misunderstandings.
They may question you, like, what is music therapy? Why? When I listen to music, I feel happy. Is it music therapy? We receive a lot of questions like this. So we are not just playing music and having fun. We have our therapeutic goals, we have our assessment, we have our evaluations, and we have evidence and research-based support to our interventions.
Chung says music therapy is an allied health profession to support people to reach a better state of health and functioning. It can be used to help people with autism, cancer, strokes, elderly with dementia, Parkinson's, and also people in palliative care. However, a music therapist is not recognized as a professional in the local public healthcare system. So many local music therapists have to find jobs at NGOs or in private practice. Recently, the Hospital Authority and other government departments have started offering some short-term music therapy projects. But Chung says these are far from enough.
Neurologic music therapy isn't very well known in the Asian part of the world yet. We do rehab for our stroke patients from acute all the way to outpatient. So I think if we get to know more information about this, I think it will benefit the whole community in general.
Chung also started another choir for cancer patients, with the same aim of making their life better and helping connect them with the community. On this afternoon at this cancer caring center next to Chun Mun Hospital, the choir meets the public for the first time.
We provide music therapy to help the cancer patients and also their family members to address the emotional needs, reduce the anxiety and also depressive symptoms, but also the adjustment issues.
Cantonese oldies are some of their favorites. Apart from singing together, the therapy also gives patients a way to relax. This choir was formed 6 years ago. Members say they're happier with music in their daily lives, even though they are not perfect singers.
In music therapy, we don't put a lot of emphasis on the quality of music. So like the choir, we don't emphasize are you singing a correct note or not. We don't emphasize the quality of music. 揀一個樂器，你覺得能夠表達你當下嘅感受。
Singing together can be effective in small groups too, especially for those who have a poor mental situation. Gigi Cheng is one of them.
Now I feel comfortable when listening to music, very different from the past. My mood has changed. I used to think there was no hope.
Gigi has been single for many years. When she found she had breast cancer in 2010, there was no one to rely on, and that made her feel depressed. She refused to accept the fact that she was ill. Cheng put a lot of effort in her jewelry business. But 5 months after she opened a new shop, she was told her situation was getting worse. She had two options: close her business to focus on medical treatment, or give up. She chose the latter.
I could have been successful, but I failed to do so. I feel useless, and it's a road that leads to nowhere. So I tried committing suicide.
She says cutting her wrists hurt, but she didn't stop and continued to cut her wrists many times in the same place. She was going to wait for all her blood to drain, then she passed out.
When I woke up, the bleeding stopped. Maybe God didn't want me to leave yet.
Cheng says she didn't want to admit that she had cancer until she started to attend Cheng's music class.
When the music started, I just couldn't hold my tears. I don't know why, just feel that grievance, don't know how to express. When I'm with music, I have to admit that I'm sick indeed. For me, music is the cure.
Fighting cancer is a long journey. After 2 major surgeries, 33 sessions of radiation therapy and chemotherapy, Chang survived. But she has not fully recovered yet. She still needs to take medicine for another 5 years. Sometimes singing is not the only way to feel better. Music therapy can do much more. In 2016, Wu Chengqing was diagnosed with breast cancer. She was confident that she could be cured with the advancement of medical technologies. But disaster struck, one after another. Shortly after her first operation, doctors discovered she had another tumor in her ovary.
I have to face 3 major operations, and afterwards I have to receive the radiation therapy, and I need to go to the hospital to receive the therapy daily for more than 6 weeks. I was physically and spiritually, I was totally collapsed at that time.
It was then when she met Chung and started music therapy.
I told him, I don't know how to sing. I don't know how to play any of the musical instruments. I think you better not to waste time on me and spend more time to other patients. But he is very patient. He tried to engage me.
Without music, she says she couldn't have gone through the darkest time. Now she is feeling much better and resumed her work. Chung says the choir has been practicing English songs recently, even though most of them don't speak English, but they are willing to learn new things.